Okay, this is the dissection of the posterior medial thigh. We are going to first start out with the muscles.
The more superficial muscles are cut and reflected. This one with the red pin is the sartorius. The origin is the crest and ventral border of the ilium. It inserts on the patella, the tibia, and the fascia of the knee. The action of this muscle is to abduct and rotate the femur. This also cut and reflected, this black pin is the gracilis. Its origin is the symphysis of the ischium and the pubis, deep in here. It inserts on a thin aponeurosis on the medial surface of the tibia, and it's continuous with the fascia of the shank, and its action is to adduct and retract the leg. The white right here at the bottom is the semitendinosus. Its origin is the ischial tuberosity. The insertion is the medial surface of the tibia, and its action is to flex the shank. And this blue one here, the next one up, is the semimembranosus. The origin is the ischial tuberosity and the ramus of the ischium. The insertion is the medial epicondyle of the femur and the adjacent medial surface of the tibia, and the action is to extend the thigh.
The red pin is in the adductor femoris. It originates in the pubis, and its insertion is the medial femur. The pink pin is in the adductor longus, and it also originates in the pubis and inserts in the medial femur. The green pin is in the pectineus, and it originates in the pubis, and it inserts in the pectoral line of the femur. The yellow pin is in the iliosalis, and it originates in the lumbar vertebrae and medial ilium, and its insertion is in the lesser trochanter.
Okay, now that we talked about the muscles, now we're going to talk about the joints.
There's two joints located in the thigh. The first is the hip joint, and the types of articulation is ball and socket joint, which is considered diarthrosis. And the movements of this joint are flexion, extension, adduction and abduction, circumduction and rotation. And then the knee joint, the type of articulation is a hinge joint, which is a synovial joint. Structurally, the knee is composed of two joints within a complex synovial capsule, a joint between the tibia and femur, the tibiofemoral joint, and one between the patella and the patellar surface of the femur, the patellofemoral joint. And the movements are flexion and extension and a slight medial and lateral rotation.
Okay, those are the joints. A little FYI about the dissection. Right here is a false divider for the rectus femoris. It's all one muscle. Do not separate it, otherwise you're pretty much just going to ruin your rectus femoris. Then, when you cut and reflect the gluteus and the sartorius, there is connective tissue right here along the side of the knee. You have to be careful to cut that, otherwise you're going to be cutting into other muscles and possibly cutting into the knee and exposing the patella, which would be bad. So here is our dissection. John,
Renee,
Karen,
Christina,
and that was our posterior
medial thigh.